Have you ever been in a hospital and wondered what a nurse is really thinking when they're doing their rounds? Well, it's way more than just checking off boxes on a chart. A great nurse is basically a clinical detective, always on the hunt, piecing together these tiny, subtle clues to solve the biggest mystery of all: what's going on with your health?
So really, what are they looking for when they check your pulse or ask how you're feeling? It might seem like just a routine, but it's not. They are on a mission. They're hunting for very specific pieces of information that, when put together, tell a much, much bigger story about what's happening inside your body. Exactly. They're looking for clues. Every single observation, every question they ask, it's all about gathering evidence. These clues help them spot trouble before it gets serious, manage your care, and, ultimately keep you safe. So today, we're going to crack open their case files.
All right, case file number 1. This one takes us into something called a neurovascular assessment. Now I know, that sounds super complex, but it's one of the most fundamental investigations a nurse does, especially when an arm or a leg is at risk.
So what is it? A neurovascular assessment is basically an investigation to make sure the nerves and the blood vessels in a limb are healthy and doing their job. This is absolutely crucial after, say, a broken bone, a big surgery, or even just getting a cast put on. Why? Because swelling in a tight space can cause all sorts of serious permanent damage. And to crack this case, nurses have this kind of secret code. It's a really clever memory trick called the 6 Ps. It's a simple but incredibly powerful tool for remembering the 6 key clues that scream, "Something is wrong here." So let's break down this code. It all starts with pain, but not just any pain, pain that's way worse than you'd expect. Next is pallor, which is just a fancy word for the skin looking pale or even bluish. Then pulselessness. Is that pulse in the wrist or foot weak, or maybe gone altogether? Paresthesia, that pins and needles feeling? That's it. Paralysis is a big one. Can you even move your fingers or toes? And the last one, poikilothermia, means the limb feels really cold to the touch. Any one of these Ps is a major red flag. And finding these clues is a very hands-on job. To check for paresthesia, that's the sensation part, and paralysis, which is motor function, they don't just take your word for it. They do these really specific nerve tests, like asking you to make a certain sign with your hand or checking for feeling in very specific spots. It's incredibly detailed work.
Okay, let's move on to our next case file. This one's all about decoding the most subjective clue there is: pain. See, pain is a signal from the body, for sure, but man, it can be a really tricky one to interpret correctly.
Now here's the thing you have to understand. Pain isn't just some symptom to be managed. In medicine, pain assessment is actually considered the 5th vital sign. It's right up there with your blood pressure, heart rate, breathing, and temperature. That's how critical it is to get this piece of the puzzle right.
So, to investigate it properly, our clinical detectives have another tool in their belt. If the 6 Ps were for checking nerves and blood flow, the PQRST mnemonic is the framework they use to do a deep dive into someone's pain and make sure their investigation is thorough every single time.
This code helps the nurse get the whole story. So, P is for what provokes the pain. Q is for the quality. Is it a sharp pain, a dull ache, a burning sensation? R is for radiates. Does the pain travel or move anywhere? S is for severity, on that classic 0 to 10 scale we all know. And T is for time. When did it start, and is it always there? It's basically a structured interrogation of the pain itself.
Now, this system is fantastic, but what about the really tough cases? What happens when your subject can't talk to you? Think about a little kid or a patient with dementia. How on earth do you decode their pain signals?
Well, for kids, the detectives get creative. The Wong-Baker Faces Scale it's a brilliant tool. A child who can't really describe their pain in words can almost always point to the face that shows how they feel. It's like a universal translator for a complex emotion.
And for adults who can't communicate, maybe someone with advanced dementia, there's something called the Abbey Pain Scale. Now this is pure detective work. Here, the nurse actually scores the pain based only on things they can see: facial expressions, body language, behavioral changes, even things like a spike in blood pressure. They're literally reading the body for clues instead of just listening to words.
Okay, this brings us to our final and probably most high-stakes case file: spotting a patient who is just starting to go downhill. This is where all the detective skills have to come together to catch a huge problem before it becomes a full-blown crisis. The clues here can be incredibly subtle. It might be a sudden little change in vital signs, or maybe they seem a bit confused. Their skin might be pale or clammy. A really good nurse is trained to see that these aren't just random isolated events. They're pieces of a puzzle,
and they might be pointing to a really serious downturn.
And to make sure no clue gets missed, hospitals have these powerful systems, like the Adult Deterioration Detection System, or ADDS chart. Every observation, from breathing rate to their level of consciousness, gets a score. It's a genius way to standardize the investigation and turn that gut feeling of something's wrong into hard data that demands action.
And when those scores flash red, a very clear protocol just kicks right in. The #1 rule is always stay calm. Then call for help immediately, run through a rapid ABCDE assessment, that's airway, breathing, circulation, and most importantly, you stay with the person. The clues lead directly to a fast, decisive response.
So, we've looked at these cases, we've seen the tools, the techniques. What's the final verdict? Why does this intense level of detective work in nursing matter so much?
Well, it matters because this is the absolute foundation of patient safety. This constant, skilled observation literally saves lives by catching problems early. It prevents horrible complications. It gives doctors the data they need to make the right calls. It makes sure the right care gets to the right person at exactly the right time. It's not just another task on a list. It is a life-saving skill. So the next time a nurse walks into your room, I bet you'll see things a little differently. You won't just see someone doing a job. You'll see the clinical detective at work. And you might even ask yourself, what clues will I notice them looking for? Because what you're seeing isn't just a routine checkup. It's a master investigator dedicated to solving the most important case in the entire hospital, you.